Hi, everyone, and welcome to our lecture on social determinants of health. We've covered the historical foundations, our beginnings in public health and public health nursing. And now, before we get any further, it is really important that we talk about social determinants of health. This is a concept that has been growing in our public health arena. Unfortunately, it's taken a while to come into the forefront. But basically, what this is looking at is it's asking us to look beyond what we're used to looking at for determinants of health, such as genetics, such as lifestyle, and treatment, but to look at the other things that the environment that we live in, the race or ethnicity that we are, that the culture that we live in. There's lots of different avenues that we can look at for the social things that often determine our health more than genetics. And if you've just watched that fabulous TED Talk by Rishi Manchanda, he says that our genetic or our zip code matters more than our genetic code. So we're just going to continue where he left off and talk about social determinants. Healthy People 2020 is still what we're using. They have created the framework for Healthy People 2030. You can look at that online. But Healthy People 2030, its entire list of objectives was supposed to come out this spring and got delayed due to the pandemic. So we're still working with 2020 objectives. But this is the way that our nation, as a public health, with a public health lens, says these are the things that we want to accomplish in a 10-year period. And so these are just a few of the objectives related to social determinants of health. I underline ones that I think are extremely important, that we look at how we can achieve health equity and eliminate disparities. We will continue to talk about disparities, especially as they relate to race and ethnicity later in the semester, and that we create good social and physical environments. So again, looking at the greater environment that people live in and how that affects their health. I like this vision of how we can move towards equity. So first we look at disparity. Everybody comes in at different heights, or everybody comes at health from different advantages or disadvantages based on your income, maybe your parents' education, your culture, where you live in the country, what your neighborhood is, etc. And equality says we're going to give everybody the exact same thing, the exact same amount of services, of support, and then they'll just go to where they go. But as you can tell, when we start with different advantages, different levels of advantages or disadvantages, giving everybody the same thing doesn't help everybody reach the same level. And so this is where equity comes in, and we say we have to meet people where they are. Some neighborhoods are going to need more support, more services, more funding than other neighborhoods, as one example. Please click on this video here on the left. It's just a little over a minute, and this gives an excellent description of what health equity is. Something that is very much on the forefront of public health organizations. The American Public Health Association, the big federal one, their conference last year, their national conference, the theme was actually health equity. And so here is taking that image from before and going to the next level. So we've got on the far left, we've got equality. On the middle, we have equity. On the far right, we have just completely removing barriers and disparities. So it's looking at how can we look at systemic problems, such as structural racism. That's something we'll talk about again later in the semester, so that we don't even have to worry about giving people different things, but that we've removed the barriers completely. So I'd love for you to begin thinking about, maybe with the populations that you work with, maybe in the neighborhood that you live in, what are some systemic barriers? Maybe it's structural racism, maybe it's residential segregation, maybe it's a lack of access to healthcare. Maybe it has something to do with immigration status, things of that nature. And what are ways that we can begin to think about taking down those barriers, and so that it's not just a matter of giving more funding or more access to certain neighborhoods or communities versus others. So this is the formal description of social determinants of health. It's the conditions in which people are born, live, work, and age that affect their health. That goes along with our TED Talk nicely. And that these things underlie preventable disparities in health and disease outcomes. And that we can do a lot to prevent the disparities that we often see, especially as it relates to race and ethnicity and zip code, and health outcomes. There are things that we can do to prevent those disparities. We need to have policies that affect entire populations over extended periods of time. This is big picture thinking. And that ultimately we're trying to create a healthier workforce, because that's what's going to promote our national prosperity. And if you think back to last week's lecture on the Constitution, that was what we were all about, right? Public health started with creating a healthier and productive workforce. This is the way that Healthy People has organized the social determinants of health. They have them in 5 different categories. I'll let you look at this yourself. And then in the next 2 slides, I have them broken out into more specific categories under each of the 5 domains, if you will. And then I would love for you to click on this link up top. What are some health indicators for SDOH and how are we doing? So this is basically a way for you to look at. I'll click on it here with you, but then I would like for you to explore this in more detail. But what are we looking at with social determinants of health? So there's 11 objectives currently for the Healthy People 2020. And some of them are really interesting. Like this first one says, we're trying to increase the proportion of children under age 18 who live with at least one parent who's employed year-round, full-time. So this is not temporary work. This is not seasonal work. Do they have at least one parent that has a steady full-time job all year? And then you can click on different things to look at charts and look at how we're doing with that objective. The second one, and this is a big one that we'll continue to talk about, is related to education. So the percentage of people who complete high school and then immediately enroll in college that next fall. What's interesting is that there's also a growing trend with millennials and the next generation actually to take this gap year and go travel or serve or do something different abroad. So I don't think that that is actually often a sign of privilege, and I don't think that's what they're looking to erase here. So that might be an interesting thing that messes up the data if that becomes more widespread. Things like the proportion of people living in poverty, children living in poverty. This is a big one, especially for San Diego, the proportion of all households that spend more than 30% of their income on housing. As you probably know, in San Diego, a large percentage of people have to spend more than 30% of their income on housing because our housing prices are through the roof. This image here just depicts kind of when we're talking about social determinants of health and equity and how those things go together related to the community, individuals, the environment, and then our society as a whole. So what social determinant of health do you think is the strongest predictor of health? A hint, we explored this in the article that you read this week called A Dying Town. Economic stability, education, social and community context, or health and healthcare? And the answer is, oh, one more option, neighborhood. The answer is education. So just a few things to point out. At age 25, people without a high school diploma actually have a life expectancy of 9 years less than college graduates. These are just a few of the many, many statistics that are out there that point to education as being a very prominent social determinant, that the prevalence of diabetes is more than double for people who have not completed high school as compared to college graduates. So I'd just like you to think about this, maybe pause for a second and think about, what do you think is going on? Why does education play such a huge role in our health outcomes throughout life? And why are college graduates so much more likely to have better health? This I'm going to leave up for you to explore, again, to pause and to begin to think about. These are the things that I want you to be pulling out of that article, A Dying Town. What are deaths of despair? What are we categorizing there? There are specific things in this article that people with higher education are more likely to do, such as wear seatbelts. And what are the different reasons that people didn't go to college in this article? What are some of the barriers that are keeping people from getting educated and in turn improving their health? Again, I just have listed here more examples of social determinants of health in a more specific arena that you can explore. And then I want you to consider this for part of your discussion this week. This is a screening tool, comes out of the Ohio Department of Health. It's called the Core 5. And it's basically something that can be used very quickly. Kaiser has a small version of this, not this exact tool, but a similar tool that I've experienced as a patient at Kaiser. In the waiting room, you come in for whatever kind of checkup you're going in for, and they hand you kind of a quick checkoff thing to look at social determinants of health. I think this is a great step in the right direction, that we're not just asking about medical needs, but we're asking about things like, do you have enough food to feed your family? Are you worried about losing your home? Things like that, that really do greatly affect health. And then the last question I want to leave you with is a big one, something that we can debate for hours. But do you think that health is a right, or do you think it's a privilege? And this will dramatically affect the way that you approach healthcare, the way that you approach social determinants of health, and the policies that you push for or that you vote for in our country. So understanding the ways that people approach health as a right or a privilege will help us as we move forward in looking at systemic societal changes.